Well, we are nearing the end of Arthritis Awareness Month, but before May comes to a close, we wanted to chat with 9 News health expert Dr. Payal Kohli about the different types of arthritis and what we can do to prevent them. So we got Dr. Kohli back here. Thank you for staying around just a little bit longer.
Yeah, my pleasure. Such an important topic.
100%, because it's unbelievable how common arthritis is among so many people.
It's so common, Jordan. So 30 to 40% of people over the age of 65 and about 50% over the age of 85. So age is really the biggest risk factor for arthritis. And there's a few different types of arthritises. So the one that we sort of think of most commonly is the osteoarthritis. That's the wear and tear arthritis. That's the one that many of us will get, or parents have, or what have you. But there's also an inflammatory arthritis, which is something like gout, where you get crystals that deposit in the joint, and then that triggers an inflammatory response from your body. And then there's these class of autoimmune arthritis, where your body gets confused and your immune system starts attacking your joints. Those are arthritises like rheumatoid arthritis or psoriatic arthritis.
I know some of it, of course, comes through your genes, but
Yeah.
outside of that, is arthritis preventable? Are there steps you can take to try to stave that off?
There are, actually, and it's really interesting because we're learning more and more about what the risk factors are for arthritis. So age is something you can't change, right? But your posture and the way that you train your muscles around your joint is a big factor in terms of preventing arthritis. So if you actually build muscle strength around your joints and do more flexibility exercises, that can reduce your risk of having arthritis. Now, interestingly, women have a higher risk of arthritis, osteoarthritis, than men, and part of that is the shape of the woman's body. So if you think about her pelvis, it's actually a little bit wider because it's designed to carry a baby.
Right, yeah.
So she has more stress on her knees. And so women get arthritis in different joints than men do. There's also this hormonal component. So after menopause, women can have more arthritis because estrogen actually protects the cartilage, prevents it from wearing down, which is the main problem in osteoarthritis.
I think one thing that you said was really interesting to me. When we think about pain around our joints, we think we need to do less. Is that kind of the opposite case? Should you actually maybe be trying to do a little bit more, like you said, to build that muscle up around your joints?
100%. So one of the best ways to sort of treat arthritis naturally, and I really advise people not to pop an Advil or ibuprofen every day,
Right,
because that's bad for your kidneys, your heart, your blood pressure, what have you, is to do more exercise. So it actually does a couple things. One is it lubricates the joints better. The second is that it strengthens the muscles around the joint, so actually it takes the tension off the muscle. And the third is that it actually stimulates kind of more healing within the joint. Now, you want to make sure that these are low impact exercises, not high impact.
Right, yes.
Because high impact can certainly worsen the pain of arthritis. You also want to make sure you're thinking about factors like your weight. So if we have a little extra weight on us, in addition to bad posture, in addition to sitting all day, all the things that we do, you can imagine how that puts more stress on our back, on our knees. Even sitting at a computer all day can cause arthritis in our hands as well.
Now, let's say you've already been diagnosed with arthritis. What are ways that you can cope with that?
Yeah, so I would say try to use heat and cold therapy often. So if you have a day where you're having a lot of flare of pain, do not pop a painkiller. You really want to try to use natural ways to sort of treat it. Staying active, as we've talked about, is really important. Believe it or not, sleep is really important to helping your joint kind of heal. Now, the cartilage, which has been kind of worn away, doesn't grow back really well. So sometimes people will end up getting either a knee replacement, a hip replacement, or a cartilage transplant to help heal their arthritis. But those are really extreme things. I would say if you start at the earliest signs of arthritis, to really take more care of your joints, work in a little bit of yoga and Pilates every day, because that really improves the flexibility of the joints. Those are ways in which you can prevent it from getting to the point where you're going to need a replacement.
Those mobility exercises, that's what you really want to focus on right there. All right. Dr. Kohli getting on to us about the sleep again. We're working on it, I promise. Dr. Kohli, thank you very much. We appreciate it.